My name is Kay, and I'm a co-founder of Healthy Futures Global. We protect children from syphilis. Let me tell you about the first pregnant woman we ever diagnosed with syphilis. When she found out she was pregnant, she was a little bit nervous. This was her third pregnancy, but unfortunately in the first two, the children didn't survive. But she did the right thing. She went and she saw the nurse and got all the usual tests done. But this time they offered an extra test, a test for syphilis. When she found out she had syphilis, she wasn't just surprised, she was devastated. She learned that when a pregnant woman has the syphilis infection, that can pass to the child, and it's often deadly for the child. I'm sure she was thinking, if only she knew she had syphilis, maybe those first two children could have survived. Unfortunately, the story doesn't have a happy ending. There was some confusion at the clinic. They told her to go somewhere else to be treated, but she never ended up going. As far as we know, she's still out there, still with syphilis, and that child is still at risk. She's due to give birth around about now, and I hope this third child is okay. So this is the problem. Syphilis is an infection that can pass from a pregnant woman to the child. When that happens, there's a high risk that the child will die or be born disabled, blind, deaf, intellectually disabled, or with bone deformities. The good news is that it's just so easy to manage. New, rapid tests just need a finger prick and a drop of blood, and in 15 minutes, you can know whether someone has syphilis. These tests are just as effective as the old way of testing in a lab, and they only cost 90 euro cents. Once you know someone has syphilis, the treatment is even easier. If we don't treat the pregnant woman, about 60% of children either die or they're born disabled. But if we can give the pregnant women just one injection of antibiotics, more than 90% of children go on to live healthy lives. That injection of antibiotics only costs 50 cents. So that's the testing and the treatment, but where do we come into it? Supply, empower, train. Governments want to have syphilis programs, but they're overworked and understaffed, especially in low and middle income countries. We help governments on each one of these steps so that they can set up their own syphilis programs. So it's a nice idea, but we wanted to test it. We ran a pilot in the Philippines, a country with a lot of syphilis in pregnancy. We wanted to learn how to implement a syphilis program well, so that no more pregnant women need to have the same story as our first. Before we started our pilot, 14% of pregnant women were being tested for syphilis. Our pilot got that up to 96%. Our pilot was so effective, we convinced the Philippines government to take this up and implement it across the country. Our pilot saved 4 children's lives. Now that we're working with the Philippines government, we're on track to save 600 lives next year and over 3,000 in 2026. So how are we doing this? How are we growing our impact more than 5 times each year? The key is that we're not building this system ourselves. We're helping the existing government system work more effectively. That means that the work we do now, the donations we receive now, don't just save children's lives now, they set governments up to keep having that impact, to keep saving lives, year after year after year. That effect is so powerful, it puts us on track to be as cost-effective as some of the best charities in the world. We've built a team who have all the skills governments need to set up their own syphilis program. Our 4 Philippine staff have backgrounds in policy, clinical work, government, and organizational development. My co-founder, Niels, has a background as a health economist with years of experience in health strategy consulting. and I'm a medical doctor by background. On a personal note, the thing that I missed most about working in hospitals was the team. We always had each other's backs. I'm really proud to say we've built that culture in our team here, while doing work that's so much more impactful. Besides building our own team, we've been building relationships with other key players in the space. We're partnered with the Philippines Department of Health, and our work is supported by the WHO, UNICEF, UNAIDS, and CHI. Let me tell you about the story of our second pregnant woman we ever diagnosed with syphilis. So she found out she was pregnant. She went to see the nurse, got all the usual tests done, and they offered a test for syphilis. When she found out she had syphilis, they said, "Don't worry. We've got everything we need. We know what to do." They treated her the same day. She's also due to give birth around about now, and she'll give birth to a child with a healthy future. So that's the story of our second pregnant woman, and our third pregnant woman, and our fifth pregnant woman, and our 10th pregnant woman. We're raising 380,000 euros for next year. Come with us. Help us reach that target. And this time next year, we can make that the story of our 600th pregnant woman. We can give a whole generation healthy futures. Thank you.